Okay, we're here with the one and only Dr. Buffy. Dr. Buffy, how are you today?
Oh, so good. Darian, nice to be here today. Thanks for having me.
Yes, well, I'm really excited to jump into something that I think is pretty important and certainly different than all the other topics that are out there all the time. In fact, someone today contacted me, was like, I want to talk about something different than business stuff. People are always talking about business practices. I was like, yeah, people never come to me to talk about business practices. So like a lot of different stuff people talk to me about. So let's jump into your world of
Sure.
infection control, specifically nursing homes,
hmm
and how you got into this, kind of the background in this first.
Yeah, sure. Well, I mean, none of us, I would say, have a straight line to our career path, and mine certainly didn't follow. I didn't wake up one day and say I was going to try to prevent the spread of infections in nursing homes. Really through, decades of working in healthcare and most specifically the last 12 years working on reducing infections in hospitals and more at the even national level. Is in 2016 is when I was invited to participate in a national pilot study with the Centers for Medicare and Medicaid Services, CMS, and also the CDC, and help nursing homes start to collect data from this infectious disease, C. diff, and start reporting it into the CDC. They hadn't done it yet. And, our hospitals are required to report healthcare associated infections. And I just naturally thought this was what our nursing homes were doing as well. And I learned as I stepped into this role that there's between 1 and 3 million infections occurring in nursing homes every year that lead to 380,000 deaths. That's over 1,000 a day. And this was before COVID. So you can imagine, I was like, why aren't we doing more about this? And so I was a big part of this national pilot study. I helped co-lead over 500 nursing homes across the country, enroll and start reporting and conducting surveillance. And it was probably one of the toughest jobs I've ever had, given just the different challenges within our nursing homes. I was pulled into many different directions with my job, and I really was so focused on the nursing homes, I decided to launch my own company. This was in 2018, and really start working just 100% dedicated to reducing infections in nursing homes. So this was all before the pandemic, and now, here we are. So that's kind of how I
Here
got
we
started
are.
in this area. Yeah.
Here we are. I'm somewhat familiar with nursing homes. My wife has worked in them throughout the years. She's been a nurse for 27 years and in assisted livings and things. And I always wonder what what's the deal with nursing homes? I always feel like there's always something going on there that is different, or the care is not where it should be, especially in infectious control. What are the primary issues you saw in these 200 visits or so you've done, and more, obviously?
Yeah.
What's the common denominator among all facilities in terms of lack of infection control or better mitigation of it?
Yeah. Well, I want to be careful because it's really easy in our culture. It's like our nursing homes are pretty much at the bottom of the barrel
Mm.
for resources, for support. In fact, we were just starting in 2016, 2017, 2018. The nursing homes were federally required to have an infection control program. I mean, we're not talking in the early 2000s, we're talking just moments before that led up to the pandemic. And there was now finally attention, like, hey, we have a problem with infections in nursing homes. But to me, it was a little too late. And so even though there's national programs, the nursing homes are always kind of
So
last
why is
to.
that?
There are many different challenges. There's many priorities in our long-term care facilities. And so all of them matter, you know. It could be just how complex the care is. And, our federal dollars can only go so far. And so we're trying to focus on other areas, of course, to keep our residents safe. But to me, there's been a lack of attention, a lack of funding. There's always lower reimbursements for this care. And so I would say that they just haven't had the attention or the support. And so as in our community, I'm sure you've seen this or you've heard it from your wife, and thank you to your wife for her service in this industry. But it's like the news media, when something bad happens, it is blasted all over the news, right? I mean, that's what we see. That's all we really know. I mean, do we see on the nightly news of like the great care a facility is providing? No. Right? Do we celebrate even nursing home workers? I mean, during the pandemic, we were celebrating our hospital workers and making sure they had PPE. All the meanwhile, our nursing homes had no PPE, and we were vilifying them like they were almost like these horrible death traps is what the media would portray them. So it's just a way that we as a culture perceive them, and then as the community, we don't know any different, right?
Yeah.
I mean, so it is complex, and that's why I wrote my book, because as I was traveling across the country in all these different nursing homes, I kept hearing the same story over and over and over again, and I felt like more of a moral obligation to tell the story so that the truth can actually be talked about, and not the truth about these horrible nursing homes, the truth about the dedicated staff that show up every day, the truth about their actual challenges, and the truth about really how we as a society have kind of put them as a last priority for funding, for support, as far as like legislative measures and whatnot. And really a call to action that we can do better than this.
Is there a strange relationship we have with senior citizens in the United States versus other countries?
Yeah, I mean, I had interviewed a gal from the Philippines, and for my book, and actually a lot of the healthcare workers in our long-term care are from other countries.
Correct.
And it is in their culture. Like, they're kind of baffled when they first come to the US. They're like, wait, your elders, your disabled are all in one place. They're not with the families. We just have a different culture. And for example, this nurse that I had interviewed, she was from the Philippines, and their culture is different. They are multicultural in their homes. When the daughter gets married or the son gets married, the wife comes and lives in the house, and then as they grow up, there's always kids or family around. So when grandma is sick and not able to care for herself, there's always family there to care for them. And we just don't have that in our culture. I don't think it's wrong. It's just different. It's just different.
It's just definitely, in traveling to different places, you see the difference. And then, I mean, it's funny how humans are in different places in the world, and ethnicities and cultures, and how we treat each other in different ways. But I want to get into the infection control aspect, like in the pandemic. So obviously you're talking about these things pre-pandemic. What did you see as we started the pandemic, and as we kind of got into the early stages? What was the infection control kind of anomalies or things that you were seeing were like, wow, this is a real issue?
Yeah. Well, I just want to back up just one step and say that when I started my own business, I have an epidemiology background, data analytics. And so I'm all about measuring and data, and the CDC, that's kind of where I was getting, having nursing homes report into the CDC. And I was so on fire about this. When I started my company, I'm like, I'm going to get every nursing home in the country reporting their data to CDC, and we're going to know what the infections are, and we're going to work on them.
It's a tough job to do.
I was so excited. And because I see the power of it, right? I like when we can see what's wrong, then that's power, and we can work on it. And I started going into nursing homes, and I was like, I started seeing basic infection control practices. Like nursing homes didn't have good access to hand sanitizer. Their environmental cleaning was very poor. So I started seeing these basic principles that I was like, oh my gosh, like I need to start with step 1, not step 30, like be
Yeah.
realistic here. So these were things that I started seeing before the pandemic. When we started hearing about this virus, I knew our nursing homes. Well, first I was praying and hoping it wouldn't get into our nursing homes for a variety of reasons. And I talk about that in my book. But I knew we wouldn't be prepared because we weren't prepared for just our basic infection control practices before. And so it's like, you need time, right? And we didn't have the time. It was only in 2017 that it was federally required for a nursing home to have an infection control program. It was only the end of 2019, November of 2019, that each facility in the US was required to have a part-time staff working on infection control. So we weren't prepared. So you can imagine that as we stepped into it, as the crisis unfolded, as nursing homes began to be required to take residents, whether they were prepared or not, whether they had PPE or not, whether they had staff or not, they were required to take care for residents. It was just a crisis, and we didn't have what we needed. I worked with facilities that were duct taping garbage bags together because they didn't have gowns. We had staff quit, because they were afraid. And so if the basics weren't there before, you can imagine that they weren't there, they weren't prepared. The hospitals weren't even prepared. Nobody was prepared for COVID. And hospitals have had robust infection control programs for decades. So to say then, there's no way our nursing homes could even come close to being prepared.
Yeah, of course. I mean, what was the emotional fallout of all this that you've seen with talking with,
Yeah.
I'm going to say this differently. So, because I was thinking about how my wife would say this, with this, like the caregivers of the people in the home, the children of maybe their parents who are living in nursing homes. What was the information and that was disseminated to them, and what's the fallout emotionally that you saw in all these places that you visited?
Yeah. I mean, ultimately, that's why I wrote the book, to actually deal with my own trauma, because it was when you hear the same story over and over again, and you hear the pain, and you sit and cry with the administrators or the staff. It's like it just compelled me. Like I had to write it for my own therapy, in a sense. Like I can't hold all this in me. I've got to share it, right? And that was it. I mean, we've had, as far as the fallout, I mean, we've had so many people leave the industry. We always had high turnover in this industry anyway, but it's at a level that none of us have seen now. And what I'm starting to see is now even the leadership team, the administrators, the directors of nurses, they're like, I'm just done. Like, I'm over it. And I just want to slide this in here because it's important. It's important for people to know this. I just mentioned how the nursing homes weren't prepared. I just mentioned how they were just starting to really ramp up on their infection control practices. And what's important to note is the state and federal survey process that occurs every year through CMS. It's a requirement to participate. It's a requirement to receive funding from Medicare. All surveys across the entire medical industry were halted in March of 22 because of the pandemic. Except for nursing homes, there was an actual increase in funds of $80 million for state surveyors to go on site to nursing homes in the middle of an outbreak and basically point out everything they were doing wrong and provide citations to them. And I say that because that's what was causing so much of the stress, because guidance was changing sometimes 2-3 times a day. And it was literally, then you'd have a surveyor come in and basically hand out a citation for this nursing home for what they were doing wrong when nobody knew what we were doing. So instead of support and collaboration, they got punishment. And I think it's important for people to understand that, because it actually made the response for the nursing homes even harder. They had to jump through a lot of hoops with paperwork. They had to stop what they were doing to answer survey questions. And it just made, it's like fighting a fire and you have your regulatory agency coming in and saying, we're going to check your sprinklers now. That's not the time to do a survey, right? That's not the time for an inspection. And so that also added a huge burden to these facilities that nobody knows about. None of the public are aware that that occurred.
Yeah. I was like, I never heard of this. And I'm
Yeah.
pretty sure a lot of people have no clue this was happening during this time.
Yeah, that was probably one of the biggest burdens. That by July of 2020, nursing homes had been fined over $15 million in citations. And that was
Wow.
just July of 2020. I don't
Oh my
know what
God.
the stats are after that, but I was actually I was on site in a nursing home and I saw this process unfolding. And it was devastating even to me because we're right in the middle of an outbreak. You're doing everything you can to protect the residents. And then the surveyors walk in the next day and they're going to tag you because maybe your gown isn't tied the right way, or you didn't disinfect a pen the right way. Like that was the nitpicky stuff that the facilities were getting in trouble for. And that was very hard. That was very burdensome for the community, for the nursing homes.
I think this is part of the frustration with kind of regulatory agencies is this strange relationship of like, kind of what needs to be done, but then you allocate resources for something that seems very frivolous during the time period that something needs to be done. And I've seen this, like when I just interviewed somebody in the child welfare system working there, almost the same exact type of thing and how it works. I'm trying to understand. I understand it's a lack of priority, but it feels like there's something deeper there. That there's got to be something deeper. I don't want to believe that it's just ridiculousness from people. Like, what's the deeper meaning behind this that we keep doing stuff like this?
Well, I'm not entirely sure. And, when I first started writing my book, I was starting to write it from the perspective of an infection preventionist epidemiology, because that's my work.
Yeah.
And I started to write about it. How could I ignore when I'm talking to these facilities? This topic kept getting brought up over and over and over again. And I'm like, okay, I don't know anything about this, but let's explore this a little bit deeper. And I mean, I know we need regulations in this industry.
Sure.
Like before we had regulations, it was a mess too. So I just think we've swung to an opposite extreme where our go-to is to punish. Let's fine the nursing homes. Let's, throw more citations at it, more monetary penalties, and that's going to fix it. Well, from my experience, it doesn't. From my experience, let's say they got an infection control tag. They have 10 days to show the state they're in compliance, which is fine. Then the state surveyor will come out and revisit and make sure they're in compliance. They may have to submit some audits for a few months, but nothing's changed. There's not real change that occurs. And so what I'm asking for is there's actually a call to Congress for $500 million for more of these surveys. And I say, what if we use some of that money, at least half of that money, for support, for collaboration?
Who's coming up with these figures, these numbers, and why are they pushing more of this? Like, who's pushing more of this?
I think it's what we've done. And here's the perspective that I don't want to say that I don't understand this, because there are bad facilities out there.
Sure.
There are harms that happen to loved ones that are devastating and that are absolutely uncalled for. I am not naive to the fact that happens. And there are bad actors that are running some of these nursing homes that will take dollars that are supposed to go to frontline and put it in their pocket. Like, I'm not saying there is corruption as in any industry that occurs. So let's deal with those bad actors. Let's deal with them, but not punish the entire industry as the result of that.
But how do you have a more moderate? You said swing to the extremes, which that's in a lot of things that happens.
Sure, of course.
With our country especially. But how do we get more to a moderate a more practical approach towards this in nursing homes?
Well, fortunately, I mean, as I was writing the solutions, because I don't want to just talk about the problem,
Of
right? Like
course.
let's get into the solutions. And as I'm searching out the solutions, there are solutions that have been they're kind of ready for us to step into right now. So for example, CMS is the regulatory body, but they also have a division called the Quality Improvement Organizations, or QIOs, I used to work for a QIO that offers support, that offers collaboration. So you already have this built-in system funded by the same agency, that if we provided more funding, it could hire more staff, then we could do more on-site visits and actually support them and track that support, then we can really go a long way in ensuring that the improvement is occurring. So there's already that built-in mechanism. There's a built-in mechanism even through the health departments. They have a healthcare associated infection, HAI division that's from the CDC. So like we have these divisions, but unfortunately, in the budgets are very small. So let's increase those budgets so we can hire more staff to help with this work, versus just kind of, I almost want to say it's kind of an easy way to say, we're going to throw all this money and find them and cite them. That just adds so, if I could just describe to the viewers how that feels to the people working in the middle of a crisis, where they had the state surveyors come in 5, 6, 7, 8 times and just pointing out what they were doing wrong. It's like, who wants to go to work and deal with, you know what I mean? Like,
of course.
Was there anything we really knew about COVID in the beginning? No.
I
mean, we were all just trying to operate the best we could. So I just say, let's give our nursing homes, let's cut them a little bit of break while we help them, hold them accountable, and provide the support. So one thing my company does is, and we're actually funded through a QIO, so CMS is starting to work on this, is we are going on site to facilities still, and we provide one-on-one support. We do an assessment. We are there to help. And 99%, there's always that 1%, but 99% of our nursing homes say, why can't we have more of this? This is what helps us. This collaborative coaching, it's coaching, and to have more of these visits. And it looks like we're going to be funded to do more of these, actually. So we are moving in the right direction to be able to do more of this collaborative work. And I just got a call today that it looks like we're going to have some funding to do hundreds more. And I'm just over the moon thrilled, because this is how many more facilities we're going to be able to help and ultimately reduce harms and save lives with our vulnerable population.
Why is the funding so hard to come by? Why does it seem like you have to really push to get it when something else is like, we're going to throw a huge amount of money on something that doesn't seem that important for the time we're in?
Politics is not my gig. What I can speak to is in the nursing home industry themselves. So when I had started my company, I would reach out to the nursing homes and I was like, let me help you. Let me support you. I was very, very inexpensive, like ridiculously inexpensive. And I had a nursing home administrator tell me once, Buffy, I don't care if you only charged $1, I couldn't afford you, because there's just no room in their budget. The Medicare reimbursements, the Medicaid reimbursements and there's even, again, a petition to cut them by hundreds of millions more. So it's really through, because it's a program that's funded through the federal government. We need federal dollars. I mean, that's just what it boils down to. We do have private pay patients in the nursing homes, but if you're there long-term, unless you whittle down your entire life savings, you're under Medicaid, and those reimbursement dollars are very small for the nursing homes.
Yeah, you know what? I've talked to my wife about this plenty of times because when she used to be director of nursing at an assisted living and places like that, these were the conversations you would come home and talk to me about. Literally the same thing you're talking about. And it's kind of tough hearing that that's continuing to happen so much, because she's a nursing instructor now at a college.
Nice.
But they're dealing with it's hard to get people into the business.
Sure.
And you mentioned the staffing shortage. How
Mhm.
can that be addressed? To get more people into nursing
Yeah.
homes working, that, there's wonderful people who do these incredible jobs.
Right. Well, first of all, we need to respect the profession
Yes.
that they're in. There is very little respect for our certified nursing assistants, our that are doing the heavy lifting.
Most
They're,
definitely.
they're changing, they're bathing, they're feeding. I mean, I spend, time in the nursing homes, and you've got to, I always bring it back to this, like my grandparents lived out their final days in a nursing home, and their care was too much for us to be able to do on our own. And I think about just those two individuals, my grandma and grandpa. Then you have an entire facility of maybe 50 to 100, right? Like the care is so hard. You have even, residents that have mental decline. They don't realize, it's just a very difficult environment. And yet the staff that work in this healthcare setting, you will find many of them have worked there their entire career. They love our loved ones. They love the residents. They love what they do. It's very rewarding. I mean, it is incredibly rewarding work, but they don't get the respect. They don't get the pay. I write in my book that many, even before the pandemic, and hopefully this has changed, but many of our, like, even housekeepers or CNAs only got part-time work in nursing homes, so they didn't get benefits. They had to work two jobs to make, the 40 hours a week. Many of them are on food stamps or government assistance. So we need to make this we need to make it more of an attractive career.
Yes.
And again, going back to, you know, the whole even survey process to know that, I mean, now it's different. The surveyors aren't coming in all the time, which is good, but we just need it to not be such we need it more attractive, basically, bottom line. We need to make this a job that people are going to want to go to. They get paid a good living, where they don't, they can go to Walmart or McDonald's and make more, right? Like,
Yeah.
we have to do better than that. And right now, a lot of states, even my state of Arizona, our governor has done a lot there. They've put some grant money towards recruiting certified nursing assistants and retaining them. So, there are initiatives right now to recruit and bring in that staff, but it's going to have to last past this pandemic. We need to invest in this healthcare. We need to, because it's our loved ones, right? I mean, we are where we are today because of them. And so the end of their life, we really need to pay the respect and dignity that they deserve.
So two things. What do you think has led to it not being seen as an attractive career in these different things? And if you had the power to change it all, what would make it really attractive? What could be done
Well,
besides pay?
yeah, I mean, well, pay's a big one if you think about it. I
Right.
mean, if you can make $2 an hour more somewhere else, I
Of
mean,
course.
and if you're having to go on government assistance to pay your bills, that's going to make a difference. So pay is definitely one. But I think, it's interesting. I just talked to a regional hospital director on the phone on, I think it was Friday, and she's over a big corporation, and we talked about the culture, even in our healthcare culture. When I worked at a hospital, we referred to the skilled nursing facilities as kind of the stepchild of healthcare. So I think we don't, even as the healthcare profession, we don't respect that level of care. We don't think the care is good. We don't think the nurses are good. And many times our new grads, our new nurses, as soon as they get some experience under their belt, they're going to be out of there and go work at the hospitals. We also need to increase the staffing to patient ratio. If you're a nurse caring for 20 patients, are you going to be able to really provide good care? And that goes against your own moral and ethical standards. You know that they need a higher level of care, but how much can you really do? And unfortunately, there are not these standards of, in some states there are, but we really need lower patient to staff ratios. Right now, they're far too high, and it burns the staff out. it when you have that many patients, it's hard to wash your hands in between every resident. It's hard to clean the vitals machines and to do the basic infection control practices when you're just trying to do basic care. Infection control practices go out the door when you're just trying to deliver a meal and deliver a bath and deliver the basics that you need to provide. So we definitely need more staff to patient ratios. And I think when we do that, we'll decrease burnout, we'll decrease just the challenges that it is to deliver the good care.
Do you think it would be a good idea to have, and I don't know if this exists or not, but like staff people who are essentially in facilities who are looking over the mental well-being of the staff there, spending time with them. Like,
I would love that.
don't you think that I feel like that's such a necessary thing in any service profession like that. But I feel like as a nation, we don't see that as a valuable thing for some reason,
Yeah, the mental health too. So I'll just state that I knew when I was writing my book that I had a choice to make. I could stretch it out and it could be much longer, or I could write it, get it out, and start the second book. So that's what I did. And I've interviewed, it was an actual occupational therapist who began working in a nursing home. He actually never knew what a nursing home was until he started the person who recruited him didn't even tell him it was a nursing home. But he went through this whole thing about moral injury and how he couldn't provide the level of care. And he saw even so many of the staff traumatized. So he actually created a program on this whole process and mental health and stress management. And so I'm learning more about that as well, because the staff are so burned out and then they don't care anymore, right? Then the whole reason we got into healthcare, we're done because of that. And so we definitely need to address mental health. I started seeing this in June of 2020 when I was working with Doctors Without Borders. We actually had a psychologist on our team, and I thought that was fantastic because I'd never seen that before, and I haven't seen it since.
That's crazy that you said that. Like that, isn't that a crazy statement? That like this should be necessary.
100%. Like when you, especially in the sight of this pandemic, it's like if you have 20 of your patients die that you've cared for years, like that's your family. And then there's no time to grieve and you're expected to get up and go back to work because you have to, because you got to care for the other residents. I mean, that's, my book is a hard read because it describes the nursing homes. And I've had some nursing home administrators saying, I can't read this yet because I'm still traumatized.
Yeah.
Like I can't re-traumatize myself by reading what we went through, but also thank you for telling this story because people need to understand what we actually went through and the trauma we went through. So we do. And so one of the things I started doing with different teams that I was on is we started talking about mental health a lot on a lot of the national collaboratives as well. But unfortunately, I really feel like it gets brushed aside still too often. Ridiculous. I feel like it's like, oh, we don't really have time to deal with that. But just like you're saying, we have to deal with that now if we're going to stand up and continue on with our staff.
Pay for it later.
Yeah. Oh my gosh. Well, we are paying for it right now. We don't have staff. We're paying, and hospitals too. We do not have staff. Hospitals too. There's hospitals that are closing. There's nursing homes that are closing because they don't have the staff. I mean, I go into some of these nursing homes and they have entire wings closed because they don't have the staff to bring in new residents.
And then you have all these beds that are filled, and then you don't have enough staff, and it becomes this cold issue of who takes care of the health of the healthcare workers,
right? And that's interesting you talk about that, and I pray that we can continue to shift that paradigm, because a healthcare worker comes into the industry because of their heart, their compassion, their empathy. This is why such huge, just our hearts are so full to help other people. But we are the very last to take care of ourselves, and we're the very last to take care of each other. It's almost a sign of weakness, even in the industry, even as your colleagues, you don't ask for help. You don't take time off. it's almost viewed as a weakness. So we've got to do better. And I believe we are. I believe those conversations are really starting to happen more and more. And I just pray that they continue, because we desperately need that. And I agree, it would be lovely. Let's bring in a trained
This
psychologist.
should be a mandatory thing.
And a massage therapist.
Yeah,
I
I don't
mean,
understand. I really don't understand. Like anybody, like I was telling the child welfare worker, I was like, somebody should be coming by your desk, cubicle, whatever, every day and checking in on you.
yeah.
And that's their job, to spend time with you, hug you, tell you you're a good
Mhm.
person. We're still
Mhm.
not there. Society is valuing that as
Yeah.
that is a huge monetary gain if you think about it
Right.
for the person. You
Right.
keep them from being absent, keep them
Right.
alert and ready, and feel seen on a
Right.
regular basis.
Right. We are human beings with real
Yes.
emotions. We're not robots. We're not robots. And we have, from my perspective, and I can only speak to what I see, but I know our healthcare workers that I've seen, they've been traumatized,
Of course.
and they need help and they need support. And that needs to be a priority. Absolutely.
I mean, think about
Absolutely.
our service members that see so much
Yes.
pain and death when they're deployed. And
Right.
then what do they get? How do they debrief from
Right.
that? And it's like this,
Yeah,
it's a similar
it
analogy,
is.
it's like, but we don't give any of these folks any
Mm-mm.
time to like deal with the problems that are happening. Like in their life, they
Well,
just don't do
right.
it.
And unfortunately, like I'm thinking about these conversations I've had with nursing home administrators, and and they're just trying to hang on. Like, you know what I
Yeah,
mean? Like a lot of it is they're just trying to, I mean, if you've got, let's say, 50 patients and all your staff call out one day, what are you going to do? So
exactly.
so you're in crisis mode. So you're not, you can't even, they're in crisis too, the leadership. So they're not, you know what I mean? Everybody is just, I was in Minnesota a week ago and I sat with the director of nurses and she's like, Buffy, I wake up every day. I'm tachycardic. My heart rate is high. I have high blood pressure. I don't know how much longer I can go.
Yeah.
I'm like, I know.
I just don't understand how this changes in a quick enough time to deal with this. It's pretty dire. I mean, even from what
Well,
I know,
I appreciate you saying that, because it was literally just a couple weeks ago. It was, well, maybe it was a week or so on Mother's Day weekend. I just felt, because I say change can't come fast enough,
yeah,
honestly, because I see the pains and harms that happen every day. And so I know, as citizens, we can do something more. So, I'm reaching out to my local, House representatives. I'm reaching out to my local senators. I'm actually going to DC in June to a congressional briefing for nursing homes. I mean, that's what I'm doing. As people, if you have loved ones in your nursing home, get more involved, like even the hospitals, like, find out what you can do. Maybe there's some volunteering position that you can do to sit with, the staff or the residents. There's something all of us can do, especially if you have a loved one in one of these nursing facilities, that you can do a lot more than you think, actually.
what's interesting? I'm not sure if you heard. I'm in Washington State, and we had this thing I think that was going to get passed, was Washington Cares Act or something.
Okay.
And it was essentially the governor of our state was essentially saying, "Hey, we're going to take a very tiny percentage out of your paycheck to
Hmm.
go towards nursing home, long-term
Wow.
care." Right? This is sad. People lost their mind.
I'm
They
sure.
didn't want it. A lot of people didn't want it, and it had to be put on hold in
Mm,
legislation because there was such negative blowback
mm.
about it. I remember telling my wife, I'm like, what's the big deal? Like, should not everybody can afford to be in the different places, like, especially at this part
Well,
of life.
I think I mean, I can understand, I obviously don't know a lot about it,
Yeah,
but I can understand the blowback from the perspective of, anytime there's increased funding, we also must have increased accountability towards that
sure.
funding. There was there was hundreds of millions of dollars even in the pandemic that went towards facilities that ended up in
True.
in stakeholder, in your
Yeah.
investors' pockets. And that should never happen. That money, I say we need to grow from the top down, but we also need to build from the bottom up. We need to make sure our housekeepers, our laundry service, our food service, our the people washing the floors and the CNAs, we need to make sure they're getting the funding that is being allocated to them. So without that, it's like, yeah, I mean, the solution is not just throw more money. If you add more money, add more accountability towards that money, but let's have a plan, let's have a plan to support and help them more.
How do you add the accountability? I mean, it seems like that's so much higher than, it's at a level where like it feels secretive. Like it feels like, how do you?
Well, there isn't as much accountability right now, and that's the problem. And there is, so, it's interesting, the timing of all this, and it does give me hope. And so we talk about it's almost dire, but there is a lot of action happening right now. It was good. During the State of the Union address, President Biden talked about nursing home changes, and there is a lot right now happening. There is a call for higher patient to staff ratio. There is a call for higher wages. There is a call for increased accountability. There's also a call for lots of money for surveys. So fine, they can have that. You
can't just get everything.
No,
that's right,
I mean,
right?
but there is a call to more of this, supportive and actionable, information so that we can help. So the accountability, there is a call for that too. Like we need accountability. I mean, there was a CEO of one of the largest nursing homes that, into like, I think it was April of the pandemic, he, quit and took $50 million with him, and it's like, there was a CMS investigation, so it's like, there are things that happen like that. And so we need to address that. But again, I'm saying, let's not punish the entire industry. Let's focus on those bad actors. And then really put our attention towards how we can help the others. So that's really important.
So do you think that, there's two sides to a lot of things, or three sides, depending on how you look at it, lots of sides, right? It's like all over.
Sure.
If this is even appropriate, what are the positive changes from the pandemic that basically, like when something bad happens, we tend to see it as just bad, but sometimes a crisis creates an opportunity as well, on some level, being sensitive to what's happened, obviously. But has there been something that has shifted the industry, or you see an opening that this has created potentially, like maybe more eyes on nursing home than there ever was before?
Yeah, I mean, this is what I'm seeing right now, and I do hope it is the silver lining. I talk about this as well, is that let's use this as an opportunity to advance some of the fact that our eyes have been open to the challenges in long-term care. I mean, a lot of it's been known for a long time, but our eyes are open to the state of preparedness, to the other infections that occur. So let's use this time and work on it. And I truly believe that's what we're doing. And those are the conversations that are happening. And I know I have a big voice, and so I'll keep shouting it from the rooftops. And there's a lot of people with me that are really advocating. I mean, every single day I see stuff coming out of the Nursing Home Association and Leading Age and these advocate groups that are just petitioning for this improvement. So I feel like now is the time, and the attention is there. And so let's use it to advance these practices and make it better than it's ever been before.
Which is why I wanted to talk to you, because I think these are issues that just don't get highlighted enough, especially on podcasts. It's often a very similar business space. There's nothing wrong with business, but like there are topics happening in our world that are just not getting covered.
Right.
There's not the exposure. So the more we have these conversations and people like yourself get on, it's like, hey, open your mind. This is happening. Like,
well, and it's very rare that, I mean, almost everybody I talk to, everybody has grandparents or loved ones,
of course,
like this actually impacts all of us, right?
It's a universal
all
thing.
Of us. It is a universal thing. And it's like, nobody wants to talk about it. So let's talk about it. Let's do something about it.
It's interesting. You said nobody wants to talk about it. Is that because of the issues that we have with end of life with a lot of people, like this sense of our mortality? You think that's part of the lack of why that discussion happens? Like we're afraid to have these discussions about this time in life?
I think it's more powerless. I think people feel powerless
Powerless.
this
Mhm.
situation. I can speak to my own example when my grandparents were needing to go into a nursing home. I was very young. They refused help. So I felt very powerless. And I think as consumers of healthcare, we don't really understand what this means. We don't understand what the care should be. And we're very busy in our lives. So it's almost just easier to not put attention towards it because there's so many other things we're looking at and we just, that's not happening to us now. So
Yeah,
I'm not
that's
going to
right.
think about it. Right. And
Yeah.
I talk in my book that this could any one of us at any time, at any age, could need this type of healthcare service. I talk about a 24-year-old in my book that got in a car accident and she was in the nursing home 6 weeks. And I talk about a mom whose son was admitted to a nursing home, I think when he was 15 and spent
Mm,
over 20 years.
wow.
And she cared for him and she'd go and visit him. And so this isn't, and even if it is just for our elders, so what? Like, but I mean, we want good care and we want this service available. We don't want to wake up one day and there's no post-acute care to help us,
Yeah.
right? Like we need this service. And if you're in a position where you need this service, you are grateful. I was grateful when my grandparents, because I knew they were being cared for because I couldn't care for them at that time. So we need this service and we need people to advocate for change and to be prepared for when they do have a loved one that needs this care, right?
Preparation. That's the word. Again, it keeps
Yep.
coming up in here.
Does it?
Preparation, right? I mean, I think it's a difficult part of the human condition. We have a hard time with preparation,
Mm-hmm.
being proactive
Mm-hmm.
and say, hey, let's be prepared for, a rainy day type of thing, and
Yeah, we don't like it.
we don't like to face that,
No.
it's difficult, but I'm so thankful there's people like you, Dr. Buffy, out there that are sounding the alarm and visiting places
Mm-hmm.
and spending your time and your life
Yeah.
in these places. This is truly amazing. And I have a great respect. You talk about respect. I have a great respect for you and for all healthcare
Yes.
providers. I really do. It's so necessary. And I was fortunate. When I was in college, I took a death and dying course.
Mm.
And we were required to volunteer in a nursing home for like 4 months. So I
Wow.
spent a lot of time with people in
Yeah.
nursing homes and visited my wife in nursing homes when she was working in those environments. So I guess it just struck a chord with me when you were presented to me as someone to
Nice.
talk to. I said, "Yeah, this needs to be talked about.
Yeah.
This needs to be talked about."
Yeah.
So I
Well, thank
appreciate you.
you.
Yeah, of
Yeah.
course. Thank you for coming on. Really appreciate it. Please tell everyone how they can get the book or connect with you.
Yeah. Yeah. So my book, it's called Broken, How the Global Pandemic Uncovered a Nursing Home System in Need of Repair and the Heroic Staff Fighting for Change. It is available on Amazon in hardback, paperback, e-Kindle. And also you can reach me at my website's ipcwell.com. And we have just tons of information that you can utilize. And my contact information is Dr. Buffy at ipcwell.com. And I'd be more than happy to assist or, chat and just continue this movement forward so that we can continue to advancing best practices in this healthcare system.
Thank you, Dr. Buffy. Appreciate your time. You're awesome.
Thanks for having me. I appreciate you
Of
too.
course, everyone, Dr. Buffy here.
Thanks.